are because they've got worries or anxiety, or because they're feeling really down and sad. Those are the two kind of main areas. But within that, everybody's got their own story, and everybody needs to be listened to as an individual would be the main thing that I would say.
One of the difficulties is people don't know what are the useful things that can then help them. So there are people who need, as we said, some specialist help, but there's an awful lot of things we can do to help people grow up feeling mentally healthy. And we almost wait until people have mental health problems before we talk about, okay, how do we stay healthy? Mental health services are provided by a number of different services. The police spend a lot of their time seeing people with mental health problems, sometimes appropriately, sometimes not appropriately. The bulk of the money for mental health services in Wales, though, goes to the NHS, and actually that has been specifically ring-fenced over the past 4 or 5 years, actually. And within Gwent, we've been very keen to make sure we keep that ring-fence so the money hasn't gone down. In addition, over the past 5 or 6 years, there have been increased funding for children's mental health, so the budget actually as a whole has gone up. There's also been some new monies, which I'm sure Liz would like to talk about, looking at different ways of developing mental health services, because it's not all about sitting in a clinic and talking to people. Some people have a diagnosis and an illness, but a lot of people have more general mental health services that probably going to see a psychiatrist or a psychologist isn't the right way forward. But I'm confident that the money at the moment is being prioritised, in fact going up.
And we're really quite excited about what's happening in Gwent. We've secured some transformation funding that will really focus on how we can build mental health capacity across all agencies, police included, housing included, social services, education, and recognise that we've all got something to offer mental health. It's about recognising that all of us are on a continuum, and I've got mental health, you've got mental health, and sometimes I need more help at one point in my life than at another point in my life. We're really keen to move towards an idea that we all need different levels of support at different points in time, and that we've all got a part to play in helping each other, and that actually really basic simple things like listening, understanding another person's point of view, putting yourself in their shoes can be really, really helpful.
Our officers and staff, Rich and Deke, have undergone significant level of training which allows them hopefully to understand people who are in crisis. It's not perfect because they're not medical professionals, obviously, or myself, I've undergone that training. But what we will try and do is assist the individual or group of individuals and provide the correct route for them to receive help. We've embarked, I think it's about a year ago, on a project, or I think it's embedded now, where we have mental health professionals in our control room. So it's absolutely brilliant. I think all our officers and staff really like that, because these individuals, they're across our 5 shifts, actually possess the data we need to know when an individual's in crisis, and they've got more knowledge than us. We do a huge amount now. Probably my biggest key responsibility is the health and well-being of my colleagues within the force that I work in. They're trained to cope with traumatic incidents. They get what we call TRIM courses now. So if there's an issue happen, people will be allowed to sit down and reflect. We've got a certain group of people who are mental health champions who can assist people. Again, we have mental health courses specifically for people internally to assist our staff. I think we fell back in relation to policing with sort of hobbies and sports and activities. It's something we really push now and want everyone to get engaged with, because again, it allows them to have a bit of fun, a bit of release, and again, to build their resilience.